Smoking is the leading cause of preventable death in the United States. That is why it's important for respiratory therapists to be knowledgeable about smoking cessation in order to help their patients quit. We created this video to provide a brief overview of this topic. So, if you're ready, let's get into it. So what is smoking cessation? Smoking cessation is the process of quitting smoking. This can be done through various methods, including nicotine replacement therapy, medications, and behavioral counseling. The risks associated with smoking are well known and include the following: lung cancer, heart disease, stroke, and other respiratory illnesses. In addition to the health risk, smoking is also very costly. The average smoker spends over $1,000 per year on cigarettes. Respiratory therapists can play a vital role in helping patients quit smoking in order to improve their overall health. Next, we need to talk about nicotine replacement therapy. Nicotine replacement therapy is a type of smoking cessation therapy that helps reduce withdrawal symptoms and cravings associated with quitting smoking. It has been shown to help increase the chances of quitting by 50 to 70%. There are various types of nicotine replacement therapy, including the following: Nicorette gum, Nicotrol inhaler, nicotine transdermal patches, nicotine nasal spray, and prescription medications. Each type has its own benefits and risks depending on the circumstances of each individual patient. There are also various prescription medications that can be used to help patients quit smoking, including Zyban and Chantix. Both medications have been shown to be effective in smoking cessation by reducing the patient's cravings and withdrawal symptoms. In addition to medications, behavioral counseling is also an important part of smoking cessation. This type of counseling can help people change their behaviors and thoughts about smoking. Counseling can also help people develop coping skills to deal with withdrawal symptoms. And of course, respiratory therapists are often involved in this process. So what exactly is a respiratory therapist's role in smoking cessation? As previously mentioned, RTs can play a vital role in helping their patients quit smoking by providing information about the following: the risk, types of quitting methods, and counseling services. In addition, respiratory therapists can provide support to patients who are trying to quit smoking. This includes providing emotional support. We should also mention how to calculate pack years for smokers. Pack years is a way to measure how much a person has smoked over their lifetime. It is calculated by multiplying the number of packs of cigarettes smoked per day by the number of years the person has smoked. For example, if a person has smoked 2 packs of cigarettes per day for 10 years, their pack years would be 20. Pack years is a helpful way to measure the amount of smoking a person has done over their lifetime. It is a risk factor for developing smoking-related diseases. If you want to support the channel, be sure to like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day, and as always, breathe easy, my friend.